Hello, 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 hello. Good evening, fellow friends and loved ones. Is it's another wonderful Sunday, the 15th of November, and then we are coming to you this evening to talk about a very interesting topic. Yes, today is a very wonderful day God has made, and we are continuing our various discussions on the various health conditions and then how to treat them and how to solve them. Okay, so we begin this discussion in the name of the Father and the Son and the Holy Spirit. And so I'm sure that by the end of the discussion, we'll learn a lot and then we'll be in a very good position to explain and to tell others about this condition. So the outline for this today's discussion is the topic, a quote, the outline, that is the overview, the prevalence, the anatomy, the physiology, the pathology, some symptoms, causes, risk factors, differential diagnosis, complications, diagnosis, treatment, that is various examinations, and then various tests that are being carried out, and some lifestyle modifications that are necessary, and then some various important outcome measures that are needed, and then some precautions that are necessary for the condition, and then we will acknowledge those who are listening to us as of now. Okay, and then very importantly, our next topic. Okay, so we begin this topic. So the topic for today is called Whiplash syndrome. Whiplash syndrome, also called Whiplash associated disorders, WAD. So if you hear something like Whiplash syndrome or Whiplash associated disorders, they are all the same. In English, we say synonyms. They are all the same. Whiplash syndrome. So what is whiplash? Whiplash is a term that was clued, that is was taken from the occurrence of this condition. So it's like if you have a horse, if you know a horse, the horse is always being lashed to be able to move forward or backwards. So when the horse is lashed, he does this. So as he's doing that, he shakes its neck in such a way that the neck becomes unstable. So the same way as humans, also when some incident occurs, which we'll be talking about in later on, it results in our neck being unstable and moving this way. So this condition is basically a neck disorder. From a flyer that was ruled out earlier on this week, it stated emphatically that it's a neck disorder, and that is very true. And this condition mainly affects the neck, which is called the Whiplash syndrome or Whiplash associated disorder. So Whiplash syndrome is a neck injury due to forcefully and rapidly moving the neck back and forth. So as the continuing effect of this movement is a result in distraction of various structures around the neck region, and this could result in Whiplash syndrome. Okay, so how common this condition is? Very common, but it's also on a low key because it doesn't really, most of the condition, that's this condition, doesn't produce severe pain that will necessitate you to visit a medical doctor or a health professional. So people keep it and then they manage the pain. They take in painkillers, they take in other pain relieving medications to be able to subside the pain. But when it becomes very severe, he or she has to report to the medical doctor or the therapist. Okay, so this common condition is mainly from a rear end accident. So where you are in a car and then there's always brake, the car brakes in and out, brake in and out. So when the car brakes, you move forward and then move backwards, move forward. So it involves you moving the neck upwards and backwards, forward and backwards, and this creates instability in the neck region. Already the neck has very, very, very tiny bones and tiny structures that are very important and connect, especially the vessels. They connect from the lower region of the body to the brain, and so when the neck is not stable or is disorganized or is traumatized, there is this instability in the neck region, and so this could also cause whiplash syndrome. Okay, and this could also be result as a this could also come as a result of physical trauma. So when there's a blow to the neck, such as boxers, or if you have footballers where there's a hand throw, or a baseball player, there's a hand throw to the neck region, it could cause injury to some structures around the neck region, and this could result in also called whiplash syndrome. Okay, so aside the physical trauma and then accident that could result in this condition, we also have a neck sprain where we have overstretching of the structures there. We have ligaments there, we have tendons there, we have so many structures in the neck, we have so many vessels in the neck, and so this could also cause whiplash syndrome. I'm sure we are talking about it, but we'll be seeing pictures very soon of this condition, and then we'll be able to appreciate it the better. Okay, so most people get, in fact, cured or relieved of the pain in a shorter while, probably some few days or some few weeks, but quite a number of people tend to have their pain worsening over time, and these proportions of people are less than 50%. So that means that most of the people who have this condition have their pain relief. It doesn't mean that you can't have it again. There could be a subsidence of this condition or recurrence of this condition. Okay, so when this condition is noted, there's supposed to be a treatment plan by a physical therapist to be able to go through and then help relieve the pain and return to function. Okay, so let's look at some anatomy of this condition. Then now this brings us to the pictures so that we can appreciate this very, very important condition called whiplash syndrome. Okay, so let's go to some anatomy of this condition and then we can be abreast. Okay. Alright, so we can see this structure there. You can see the neck here. Yes, so this is the neck. There are so many structures here. We have ligaments there, we have tendons there, we have blood vessels there, we have so many structures there, and so they are very, very important to keep the neck functioning in the optimal mode. Okay, so these are also some structures around the neck. We have ligaments there. So in the case where there's movement forward and backwards, we have these structures getting torn, and when they are torn, it could lead to whiplash syndrome, and this could result, they could bring about pain, they bring about discomfort, they bring about difficulty in movement in to one side. So you could see someone in the seat now. You can see him here. So when the car brakes, the person moves forward, and when the car goes forward very fast, it moves backwards. So the inconsistency in the movement of the head forward and backwards could cause injury to the neck structures there, especially ligaments that are responsible for holding the bones in place. So maybe there are distractions here that could cause this condition called whiplash syndrome or whiplash associated disorders. Okay, so let's look at some more pictures. So you can see this man moving his head backwards. Moving your head backwards will cause compression of so many structures here. You could see the bone here being compressed. You could see a ligament structure here. So you can see, yes. So you see, if you zoom into this, you could see there's a tear here. Because the person has moved the neck so wide backwards, there's a structure here that is a ligament to hold the bones in place from not going backwards. But because of the pressure that the car brakes with, the person moves the head very, very fast backwards, and this will cause destruction of these structures here and could result in a condition we call whiplash. So in the case where the car is also moving the car is stable at one place and then moves very fast, the person moves head forward, and this will cause also injuries to the structures at the back here, and this will cause whiplash syndrome. Okay, so this is also a very very good representation of what we are talking about here. So we can see the normal structure of the neck here, and then immediately the car moves forward, the head goes backwards, and this will cause turning of the head or pushing of the structures backwards. And then when the car also moves very very fast forward, the head goes backwards, and then the neck turns inwards, and this will cause Whiplash syndrome. So this is a very 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 good explanatory anatomy of this condition. You can see there are in between the bones we have structures we call intervertebral disc. That's the bones sits on, and we have arteries there to carry the blood from the heart to the brain. We can have other nerves there, we can have bones there to protect and then give shape to the body. Okay, so this is an x-ray of the neck, and you can see the bones here. Some of them are straight, some of them are not in alignment, and then other conditions also can arise as a result of this presentation of the x-rays. But then we are looking at Whiplash syndrome. Okay, so this is also a picture here. You can see the neck here, not stable here. You can see other structures. We have the spinal cord in the neck. You can have the physeal joints here. We have the disc here. In between the bones, you have a disc and you have nerves. Okay. So I'm sure you've seen a lot of anatomy and then so many things. I'm sure some of us are not really science students, and we are learning a lot from our anatomy. So we are continuing our discussion on the topic Whiplash syndrome. Okay, so when someone has this condition called Whiplash syndrome, what are the symptoms? What the person presents, what the person complains of, and then we can solve the solution. So the person complains of neck pain. The person says, "Oh, my neck is paining me. I can't move my neck is stiff." Yes, so these are some of the symptoms: neck pain, neck stiffness, and then the person also complains of pain worsening with movement. So when the patient is moving to one side, the person complains of pain. So this movement causes pain. Bending especially causes pain, because as we look at initially, there could be tears in the structures there. There could be pain as a result of the tears, and also there could be loss of movement in the neck. So the person cannot move at all the neck, with the respective statement that there could be a very severe injury to the structures around the neck. There could be lots of movement. There could also be headaches, and then it mostly starts from the base of the skull. So from here to the base of the skull, this is the base of the skull. Here, the base of the skull. Here. So there could be headaches, which starts from that side, and then also be pain in the shoulder. So because there are structures that we call nerves that run from the brain to the neck down into the shoulder and to the hands, there could also be radiating pain, that is pain moving from the neck into the shoulders and sometimes to the arm and then the upper back. There could also be numbness in the arm. So when the person move your hands in the person's palms, the person complains of the fact that the person doesn't feel too much sensation in the palm. It feels like there is not too much feeling in the palm. And then the person also has complaints of tiredness. The person is fatigued all the time because of the pain in the neck. The person also complains of dizziness. So there is intermittent dizziness complaints by the person or the patient. Other complaints also include blurred vision. That is, the person cannot really see well. The person sees awkwardly, doesn't see very clearly. And also there could be ringing in the ears, so there could be some sound. The person hears it very often. Scientifically, it's called tinnitus or tinnitus, depending on how you were taught or how you pronounce it. Tinnitus, so where the person will experience noise or long sustained noise in your ear very very frequently, in your ear. So this could also mean you could have Whiplash syndrome or Whiplash associated disorder. Other symptoms also could be you can't sleep well, that is sleep disorders, or the sleep disturbance, irritability, you don't feel well, your sensation around your neck region is not so well, you have difficulty in concentrating. So when you put it to a task, you can't really concentrate to finish up the task very effectively. You also have memory problems, so the person or the patient cannot really remember things in the past very often. Also, the person is depressed, so depressed, the person doesn't feel encouraged nor motivated to do things. These are some of the same things the patients can complain about. And then we can narrow on to this condition we called Whiplash syndrome. So aside the symptoms, one may ask, what are the prevalence? When you say prevalence, it means that which people are more affected. If you know how the symptoms present themselves, then we could ask which people are more affected. So research has shown that more women are affected than men, because hormonally women tend to lose their the level of hormone production quite early. Though they start production very early, they lose them quite early because they get to a stage we call menopause. So research has shown that more women are predisposed to having this condition, but that doesn't dispute the fact that men cannot equally be affected, or children cannot be equally affected. It can affect anyone because there are so many risk factors, there are so many causes of this condition. A research carried out in the UK stated that ensuring that persons wear seatbelts at all times when in a car proved that there was reduction in the amount of or the number of people complaining of Whiplash syndrome. So we can also apply this in Ghana, though it might be very difficult, but then we can also apply it in Ghana. Also, other prevalence in the UK also stated that about 300 people out of 100,000 people were having this condition called Whiplash syndrome. And we know that in UK, many people drive. It's not like Ghana that we have few people driving or people driving. Yes, many people drive, so they are predisposed to this condition because the car tends to move forward and backwards at a continuous occurrence. Okay, so age-wise, it's shown that the younger group are also tend to have this condition more, and ranging between the ages of 18 and 23. That was the research carried out outside, but not in Ghana. Not yet a study really carried out to find out the prevalence in Ghana. Okay, so we've looked at some prevalence, and so now I'll be going on to talk about some very crucial points, that is the causes. So what are the causes of Whiplash syndrome? Okay, Whiplash syndrome can cause injury to regions around the neck, and then it could be around the spine region, it could be around the bones region. That's we have in the neck we have about 7 bones. We have about 5 bones in the neck. We have about 5 bones in the neck. We call it cervical vertebrae. So in between the bones we have a structure we call intervertebral disc. So when these bones are moved forward and backwards, they tend to press on there. So if you have the bone, if this is the bone and you have another bone, in between the bone we have a structure, in between the bone we have a structure we call intervertebral disc. So when they sit on it, it doesn't cause the bones to rub against each other, so they prevent them from wearing away. But as you move forward and backwards, because of this condition in driving, they begin to wear the structure, and then now they come into contact with each other, and then they wear and then scratch against themselves. So this can also result in Whiplash syndrome, that is pain in the neck, and then also destruction of some structures we call ligaments, because the bones now come into contact with each other. Some of the causes also are auto accidents, that is rear end collisions, where we have the car hitting against each other, so one car and another car bouncing against each other, or crashing against each other, so the person can move the head as high impact as possible, and this will cause injury to structures behind or in front of the neck. Other causes include physical abuse, that is where probably someone has traumatized you, that using the hand to blow your neck, and this could also injure the structures around the side. Also, we have contact sports such as football, we have rugby, we have so many sports which are high impacting sports, and this could also cause injury to the neck region. Aside the symptoms and the causes and the prevalence, we also look at some complications. That is, what can whiplash syndrome to a larger extent cause. So whiplash syndrome can cause severe neck pain. So the person's pain complaints in the neck can be so severe that the person cannot do anything. The person just lies down and can't do anything. Also could cause more limited range of motion. So even turning the neck a little bit slightly to the left or to the right becomes extremely difficult. And also the person could have pain moving from the neck down to the shoulder and even to the hands, where we have numbness in the fingers. Okay, so aside these complications, let's look at some risk factors to this condition. Okay, so if you have had a whiplash syndrome before and then you've passed through and then you're fine, as we said initially, it doesn't mean that you can't have it again. You can have a resurgence or reoccurrence of this condition. And this is very important, that when you have this condition and you are healed, you take the necessary precautions, which we'll be talking about talking about later. And then we can prevent them in case we have had this condition. I'm sure some of us would have had this condition before, but we might not know how to prevent it from happening again, and I'm sure we'll be talking about it. Also, one risk factor is old age. So as we grow, also the structures around the neck begin to weaken. Hormonally, we don't produce too much hormones to strengthen the structures there, and enough blood also doesn't go there. So we are predisposed to this condition as we grow older. Also, if you have neck pain previously, or you have a neck pain that is persisting, and then or you have an upper back pain or a low back pain, you could have this condition also called whiplash syndrome. Okay, aside the risk factors, now we come to how do you diagnose this condition called whiplash? How do you diagnose it? How will a doctor or a physical therapist say that, oh, I have, or the patient had this condition? First of all, they're going to look at sensation, the feeling there. So you move the hand here, how do you feel? Do you feel differently from touching this side or touching this side? Do you feel differently? And also, we're going to also check your pain level. So what causes the pain? What activities do you do to cause the pain? So in the first point, if you do this and it causes pain, it's a red flag that shows that there could be something, or there could be an injury around the neck region. Possibly it could be whiplash syndrome. Also, we are going to also check the severity of the pain. Also, we are going to check some reflexes around the neck. There are so many reflexes around the neck. And then, as physical therapists, we go through this diagnosis procedure and assessment procedure to be able to finalize on this condition called whiplash syndrome. Aside this, we also look at some outcome measures. So outcome measures are various questions that we ask as and when the patient comes for treatment, so that we can assess the level of improvement of his or her condition. Some outcome measures include the neck disability index. We also have the DASH questionnaire, that is disability, the arm, shoulder index. And then we have SF36, short form 36. These are some of the outcome measures that we use to go to assess the level of improvement of the condition as and when the patient comes for treatment. Aside the diagnosis or an outcome measures, we also have various conclusive diagnosis that helps us to also get this condition right. We have investigations such as we take in X-rays, so we request for X-rays from the radiologist or the radiographer to be able to see the bones, whether there is any break in the bone, whether there's any fracture in the bone. So we check for X-rays, and then also we go for CT scans or MRI. The last two, that CT scan and MRI, are quite expensive, but in fact, if you want to see the structures in the neck, that is the nerves, the ligaments, and then the tendons, it's very good that we check for the MRI or CT scan. Okay, so after getting all these things right, and we are zooming into this condition called Whiplash syndrome, as a physical therapist, we go through various important aspects, that is getting your plan right. The very, very important is getting your plan right. As a physical therapist, we have to get the plan right, and the first thing that we do as physical therapists is that we make sure that we educate the patient on the role of the physical therapist or the physical therapist, and then the condition itself, as we are talking about now, so that the person understands and appreciates the condition, and then how well the person is able to recover in the nearest possible time. Also, another aim is to relieve pain. The pain is a very indicator for the person coming to the hospital or to the clinic. So our aim is to reduce the pain, and at the barest minimum, relieve the pain, and also to restore movement in the neck. So if the patient is moving the neck just this way, we are aiming at taking the movement away, and then returning to very functional activity. So as a physical therapist or physiotherapist, we go through various treatment protocols or treatment procedures. The first of all is we rest the neck. We avoid inactivity that will cause movements of the neck. So lie down, and then possibly put on a collar. So we have two types of collars. We have the soft collar, we have the hard collar. So in the case where it's very severe, we advise the patient to wear the hard collar, and then when you are going to sleep, you can put on a neck collar, because that one is very comfortable and will allow you to move in a very effective way. Aside the resting, we also, if it's the first week of the pain that you report, we're going to use ice. We call ice therapy to relieve the pain. After a week going, we opt for heat therapy, that is using a device we call hot pack on your neck to relieve the pain. Aside that, you can take in some medications, analgesics or pain relieving medications such as ibuprofen, paracetamol, Tylenol. These all help to relieve the pain and improve the movement, and then also encourage therapy to become very, very effective, because with pain or with increased pain, you can't do anything, even you can't do any exercise. So it's very important that pain is reduced the barest minimum to improve upon function. So when the pain comes down, then we start with various exercises. We start with various stretches. So if it's the neck, we stretch a little to the back and to the side, and these help to improve upon the pain and improve upon the motion. Okay, so aside the stretches, we also go through strengthening exercises such as lying on the stomach to be able to raise the neck up. So we lie on the stomach and then raise the neck up and support it for some time. This helps to strengthen the back of the neck, and also you can lie on the back of the back and then bend the head forward and hold it for some time. This also helps to strengthen the neck. There are so many structural exercises such as wall exercises, we have posture exercises, we have range of motion exercises. We have so many exercises as physical therapists to be able to treat this condition. Aside that, there are other conditions that could mimic this condition. We can have cervical spine fracture. We can also have carotid artery dissection. We can have spinal cord injuries. We can have muscle strain. We can have facet injuries. We can have ligamentous injuries. So many injuries that could look like whiplash disorder or whiplash syndrome or whiplash associated disorder, but then they are not it. So with this, when we know that these are not included, then we can narrow on to the condition we call whiplash syndrome and treat them very effectively. So last but not the least, there are various stages of this condition. We have three main stages. So the first one is when the patient complains of upper and lower spine flexion defects. So the person cannot complain of pain here. When the person does this, the person complains of pain here. And also the spine also assume an S shape. So like this, while it's being extended. So when the person does this, when the car moves forward, the person does this. And also the third one is that there is entire extension with an intense shearing force that causes compression of the joints. So the car moves this way, and so there's extension of the neck and then some flexion around the lower region of the neck, and this could cause whiplash syndrome or whiplash associated disorder. So these are some of the stages of this condition. I'm sure that as of now we've learned a lot. So let's look at some of the pictures before we conclude on this discussion. Okay, so yes, so this is a picture of, you can see the picture here. Yes, so this is the neck here, the neck bending forward here, and the neck bending backwards here. And continuous bending of the neck forward and backwards could cause whiplash injury or whiplash syndrome. So you can see the neck bending. That this is called hyperextension. Hyperextension, that's movements of the neck backwards too much. And then we call hyperflexion, movements of the neck too much forward. So in the vehicle, the car moves, jerks forward, and the neck goes forward, and then the car also jerks backwards or stops abruptly or suddenly, and this also can cause whiplash syndrome. These are some of the some pictures showing the whiplash syndrome that can occur, and these are some of tears in the ligaments. You can see these are some of tears, and this will cause whiplash syndrome. Okay, so these are some of the pictures here. You can see the movements here backwards and forward. So the first stage is the normal phase, the second phase is here, and then bends forward. Okay, this is another anatomy. This is some of the structures around the neck. Okay, so this is a very good presentation. The neck moves backwards and comes to neutral and moves forward. So 1, 2, 3. So you can see it now. 1, 2, 3. So the neck moves backwards and goes forward. So you can see the resting stage, the impact stage, the hyperextension, and the hyperflexion stage. So there are 4 stages in the whiplash syndrome: the resting stage, this is a resting stage, the impact stage, the hyperextension stage, and then the hyperflexion stage. Okay, so aside that, there are various exercises that we go through. So we can see some of the exercises. We'll be seeing some various exercises for the whiplash syndrome. So these are some of the exercises that we do. You can bend the neck forward a little, to the side, to the side, to the side, to the side. These are some of the exercises that we do as physical therapists to be able to strengthen the neck and relieve the pain. These are some of the exercises that we do. Okay, so you can see the neck being pushed forward and backwards, and then to the side, and then to the side, and then holding the neck like this and moving it to the side, and also stretching the neck this way. Okay, this is what I said initially. So the person is on all fours, so raising of the head, the neck upwards, causes strengthening of the neck muscles here. Okay, so this is a very explanatory presentation of the whiplash. So you can see the neck neutral, and then the car stops suddenly and moves backwards, and the car also jerks forward fast, and the person moves forward. Without the seatbelt, this could increase the risk of whiplash syndrome. Okay, so yeah, so I'm sure we've learned a lot from this presentation. Yes, so we talk about whiplash syndrome or whiplash associated disorder. I'm sure we've learned a lot from this discussion, and we are very able to explain to other people about this condition. If you have any question, the floor is open now. You can ask some few seconds for us to answer this condition. Okay. So I can see Daniel Dodu, I can see Mr. Dodu, I can see Joan Amo, I can see Amadou Musa, I can see Edbond, I can see Seidu, many more people. So if you have any question, just a minute, and I will be ending the discussion. We also have massage that can be done to the neck to relieve the pain. We have acupuncture, we have chiropractic that helps to relieve the pain but could cause severe problems at the end. So we add exercises to it to relieve the pain and strengthen the neck. Okay, so any question, please? Okay. I'm assuming there's no question. Okay, so in the absence of no question, today we talked about whiplash syndrome or whiplash associated disorder, and we looked about so many things into details of this condition. Thank you very much for the time and everything. And so we'll be talking about another condition in our next discussion. And if you have any question in our previous lectures, previous presentation, you can ask them in our next discussion, and we'll be gladly welcoming to give you our best explanation. So it's all about RICOY Health International Foundation. Yes, it's about that. And so if you have any question, you can call us on 0540 514092, 0540 514092 for any other contribution or any other suggestions. Thank you very much. So our next topic for presentation is called Achilles tendonitis. Achilles tendonitis. That's our next discussion. I'm sure we don't like to miss it. It's a very, very interesting condition. And then we'll all have a nice time. Okay. So the next topic is Achilles tendonitis. Thank you very much for your time. I'm very grateful, and today is the 15th of November. Have a blessed evening. May the Lord be with us all. Thank you very much. Have a blessed evening. Bye. Take care. Bye.